Hi, my name is Carrie Corey. I am the owner and operator of Skinchanted in Peekskill, New York, and I am a certified oncology esthetician. So what that means, oncology aesthetics is a very new modality for the United States, and it was just introduced, and basically it's the focus of aesthetics for cancer patients. I am specially trained to help if they have had lymph node removal, if they are undergoing chemo and radiation, if they are having surgeries that kind of leaves them a little bit deformed, disfigured, and also to help them if they've had radiation burns, things like that.
My name's Patty M. I'm from Montrose, and I was diagnosed with breast cancer on May 1st, 2008. I had cancer in my right breast. I went for a mammogram in January, and it took them 5 months to determine that I had cancer. My aunt had breast cancer before me, a year before me, and since I've been diagnosed, my sister has been diagnosed, and my sister-in-law as well. So I had 6 rounds of chemo and 35 rounds of radiation and a year of physical therapy. I had lymph node removal. I had about 7 lymph nodes taken out, and I have developed lymphedema as a result of that. Most of the physical therapists didn't know anything about lymphedema. I had to call like 10 or 12 different places before I finally found someone who studied that and knew a little bit about it.
So an oncology facial is a little bit different than a regular facial. So in the oncology facials, we really design it to not hurt the patient. So if there has been lymph nodes removed, if there is a port or a PICC line, if they have a surgery site that leaves them a little bit disfigured, we definitely keep that into consideration. We also don't use a lot of steam. We don't use a lot of hot towels, never do extractions or use needlework, as a lot of them, are on blood thinners and could bleed. We don't want to create any trauma. We just want to create a nice atmosphere and make them nice and relaxed and really enjoy and have nice glowing skin. The rarity of oncology aesthetics, like I said, it's a very new modality, so there's only right now about 250 estheticians in the country that are certified in this. And it's a very important thing because we need to know how to not hurt the patient.
When I was going through the chemotherapy, I had a lot of the tingling in your hands and in your feet, where to the point where it's kind of hard to walk on your feet because they swell and it just feels funny, like walking on your feet. It feels like you're unsteady, kind of. My skin is definitely drier than it used to be, and there's a lot more redness. Like, it's noticeable, I think. I don't even like going out of the house without putting makeup on, where before I really didn't care, but now it just seems really noticeable to me. So yeah, I like to cover it up when I can. So I was at Hudson Valley Hospital. My doctor is Dr. Varanasi, and my oncologist is Dr. Ajaz, and they're both very, very excellent doctors. And I had breast cancer surgery there, and I had a port put in, and I had sentinel node biopsy as well. I think that it's very important to have your mammogram because for me, I didn't think anything was wrong at all. There was no lumps I could feel or anything. So when I went for the ultrasound, the technician checked and said that she thought everything was okay, but she wasn't sure, so she called somebody else in, and they said I was fine. Then she said, "You're absolutely perfectly fine." And I went home, and I talked to my regular doctor. Dr. Kapoor was my regular doctor at the time, and I thought, I'm done. This is good. I can wait till next year. I'm good. And she said, "No, you need to go back." She said, "Something's not right. I'm looking right at the film. You need to go back." And if she hadn't pushed me, I wouldn't have done it. But I do worry. I worry about my daughters, because there's such a big family history now. And plus the fact that myself and my sister developed breast cancer in our 40s, and I think that the odds of getting that is something like 2% of the population. Normally women don't get breast cancer till they're older, so that is unusual.
So at Skinchanted, it is very comfortable, very relaxed. I have couches, you can come and sit, have a cup of coffee, cup of tea, and I do consider myself a professional, and there are certain things that professionals need to do in this field. When you arrive, I do an intake form, and I'm very, very prepared. When I am about to touch your skin, I basically know your life story. So we take the extra care here, and if you have had cancer, I will also do a a form of your body, mapping where the cancer was located, if you had surgery, when your surgery date was, when your last chemotherapy was, when your last radiation was, and if you've had lymph nodes removed and where they were removed. The products that I use have no parabens, no preservatives, no fragrance, alcohol, dye. So in the treatments that we do, I really focus on healing the skin, calming any inflammation, any irritation, a light exfoliation with a cleanse so we get some of the dead skin off. Sometimes skin is a neglected thing when dealing with such a huge thing like cancer, so it's really just a positive way of making yourself feel a lot better, look a lot better, gaining confidence. You know, people notice when you have glowing skin, so it's really great. The HiMed products that I carry are the Gentle Cleanser and the Reconstructive Cream. I've had wonderful results with both of them, and they really do help heal, and they've got specific antibiotics to help heal the skin and make sure that there is no infections while their immune systems are weakened. The other great thing about Hylunia, the products that I carry here, is that I use the products in the facial as well as retail them. So a big part of these treatments are to be proactive at home. So whether it be a mask, a gentle cleanser, the reconstructive cream to really help with your skin, there are certain things that you can do on a daily basis to make a huge difference with your skin.
After my first facial, I feel wonderful. I think that the facial could give you a great deal of confidence while you're going through chemotherapy and radiation and treatments, and even the physical therapy, because that is it takes a lot of time. You have to go a couple of times a week usually, and it's very time consuming, so it's nice to have something to look forward to. So my granddaughter came to visit, and I was afraid that she was going to be afraid of me being bald because she'd never seen me bald before. But we went out shopping one day, and it was winter, and I came in, I took off my coat, I took off my hat, I took off my wig without even thinking about it, and I just walked away, and she said, "Grandma, you look so silly," and she just laughed and laughed. She thought it was so funny that I was bald, and I was afraid she was going to be afraid of me.
John and PJ I've never actually met, but they have affected my life and I've affected theirs as well. John is my programmer that helped me with my system to book my appointments with, and he saw that I had a Caring Cancer facial on there and kind of said, you know, what is that? And I explained to him that I'm an oncology esthetician. He had never heard of it, even though he runs a software company that helps with spas and salons. He lives in Washington, and his wife PJ, he told me, unfortunately had breast cancer. When I heard of this, I told him about the products that I had, the HiMed products and oncology aesthetics. So we went on Google and looked up an oncology esthetician in the area near him in Washington, and he actually found it for her and booked her a facial. And in the meantime, I sent him the products that I had. And he called me up the next day after he received them and said that it made such a big difference that PJ thought it was a miracle.
I have been going through breast cancer for the last 7 years. And with this, I'm at stage 4 breast cancer at this time. At this moment, I feel that cancer and me are one. It is a part of my life. It's a part of my story. And having different treatments such as Carrie and her company introducing ways to make this cancer an easier part of my life has been, it's a blessing. I truly am, blessed with knowing I don't have to take another pill to take care of my side effects. The medications I've been using is Xeloda, and this was a brand new medication that they put me on for the chemo treatment. It was my chemo pill. And with that came a side effect, which happened to be my fingers and my toes. I'm already healing neuropathy through the chemo. So when this got added to my side effects, it like took my breath away is what it did. Some of my doctor's solutions have been he wasn't surprised what was happening to me. This is something that happens to many of his patients. And as far as what his suggestions were working with just simple remedies like oil and Vaselines and soaking them. My husband was introduced to a magical fairy by the name of Carrie, and her company is called Skinchanted. And with that introduction, he had ordered the potions that changed my life. I found myself coming off of the treatment because of the side effects of the dryness. It was so painful and tender and sensitive that nothing was helping me. So we decided to come off the treatment, and Carrie had sent out these products, which was a gentle skin wash, and also a lotion, a moisturizer for my skin. And I was surprised in 2 days of using it, I could bend my fingers again. The cracks that were in my hands, oh my gosh, I almost feel like crying right now because they weren't painful, and they were healed within a couple of days. They were already healed, so I didn't have to bandage up my toes and my fingers to go to work. And so it's amazing. And the part that I can't believe is how little I have to use of this product. And I've been using it for a month, about a month and a half. And the day I started it, and 2 days into it, I called my doctor and I said, put me back on my chemo treatment. I've found the magic for my side effects with my dryness of my fingers and toes. I find that this is the magic that's gonna change my life, because this outer part of me is what people see. And with going through cancer right now, there's something about people looking at me differently already. And so what that did for my skin, not only my hands and my feet, it put a glow back into my skin and my face. And I can't believe what it did to my lips. It helps my lips too. So it's my magic cream. I love it. I feel very blessed, and I'd like to thank Carrie and Skinchanted for being a part of my life and helping cancer be a lot easier to treat through these side effects. So thank you, Carrie.
She had given up. She had been taken off of her chemo meds. She just didn't want to do it anymore, and John told me since then that she has agreed to go back onto her medication. So with that, I gave her a little bit of hope, a little confidence, and really helped heal her skin, which was the biggest gift anyone could have given me. Unfortunately, everyone has been touched by cancer, whether it be your family member, your friends, yourself personally. It's something that is around us everywhere in the world, so we can only be proactive about it. If it's going to happen, at least we can give some comfort, and healing hands really, really help with making them feel really at home. And a client shouldn't feel like it's their fault. This didn't happen to them on purpose. It wasn't something that they could control, so they shouldn't be penalized by not being able to have a nice spa treatment or to be touched and, you know, to feel physical affection. If they need to cry, that's okay. You know, I try not to get choked up, but it is an emotional journey that they're on. To find their new normal helps when you have somebody that can kind of go along the ride with you. So I encourage everyone that if you've met somebody with cancer, if you know a family member that's had cancer, please get gift certificates. Let them know that these kinds of things exist, that there is help for them, that they don't have to be in pain and physically, you know, their skin being so changed and raw and red and tight and flaky. There is something to alleviate that, so they can look their best and feel their best and just go on their day and keep fighting and keep striving for a better tomorrow.